When is open cystotomy needed for bladder stones? Imagine trying to remove a large object from a small space. It can be tricky and sometimes impossible without opening things up. That's similar to what happens with certain bladder stones. Open cystotomy is a surgical procedure where a doctor makes an incision directly into the bladder to remove stones that cannot be easily taken out by less invasive methods. It's usually reserved for specific situations where other options aren't enough. One common reason for needing an open cystotomy is when the bladder stones are very large. Stones that are bigger than about 1 centimeter often cannot be broken apart or removed through procedures like cystoscopy, which uses a thin tube with a camera and tools inserted through the urethra. Large stones can block urine flow, causing symptoms like difficulty urinating, frequent urges to go, pain, or blood in the urine. When stones are too big to be managed by other means, open surgery becomes the safest and most effective option. Another situation is when stones are causing an obstruction that prevents normal urination. If a stone blocks the urethra or the bladder neck, it can be a medical emergency. This kind of blockage can lead to severe pain, swelling, and even kidney damage if not treated promptly. In such cases, open cystotomy allows the surgeon to quickly remove the obstruction and restore normal urine flow. Sometimes, medical treatments like special diets, medications, or procedures to dissolve stones do not work. If the stones persist or grow, or if symptoms continue despite these efforts, surgery becomes necessary. Open cystotomy provides a direct way to remove stubborn stones that cannot be dissolved or broken apart. Complicated cases also call for open surgery. If there are additional issues like bladder trauma, tumors, or abnormal placement of the ureters, a surgeon may need to perform an open cystotomy to address these problems effectively. It's also used in emergency situations where a patient, often a dog in veterinary cases, cannot urinate because of a severe stone blockage. Removing the stones immediately can be life-saving. During the procedure, the surgeon makes an incision in the abdomen, then carefully opens the bladder to extract the stones. After removal, the bladder wall is stitched closed, and the incision in the abdomen is also sutured. The operation is done under general anesthesia and usually requires a short hospital stay for recovery. While open cystotomy is generally safe and effective, it does carry some risks. These include urinary tract infections, recurrence of stones, or complications related to anesthesia. Proper postoperative care, including antibiotics and monitoring, helps ensure a smooth recovery. Understanding when open cystotomy is needed highlights how important timely intervention is in managing bladder conditions. Removing bladder stones before they cause severe symptoms or complications can protect overall bladder health. It's important to remember that bladder stones themselves are not directly linked to bladder cancer, but if left untreated, they can cause ongoing discomfort and health issues. Always consult a healthcare professional for personalized advice and treatment options tailored to individual needs.